You mentioned earlier the pelvic floor being attached to the feet. That's really interesting. I remember you talking about that on the phone. And I know, like, for myself, one of my things with running at the moment, I don't really mess with sprints too often, although I have been incorporating some. And I also don't even bother to try to go 100% just yet because I don't feel like I'm all that prepared for that. So I got to work my way into it a little bit more. But my foot doesn't want to travel back behind my body very much because it just doesn't feel safe. So what have you kind of recognized in having the feet connected to the pelvic floor and the feet connected to the core?
That most people's feet are not connected to the core.
How can they tell?
So most of the issues that I find in patients, plantar fasciitis, Achilles, whatever we spoke about already, I start to ask them about the pelvis function. I watch them walk. They either have restricted pelvic T-spine mobility, which completely changes the way that we walk, and that could be like a whole nother 30 minutes that we talk about. But if they have SI joint stress, if they have low back pain, if they have groin pain. So I've actually had athletic pubalgia. So I've taken a really deep dive into understanding the anterior pubic joint and all of the anatomy and the stabilizers of the pelvis for, especially with athletics and how that kind of starts to unravel. They could have a hip labrum tear. So it's really partially based off of other symptoms that they experience and then being able to test some of that strength. But the way that I teach foot to core is really based around a tensioning, and I use the breath as the driver to that connection, which means that every time your toes push down, what happens or what should happen is that when you push your toes down into the floor, which is called short foot or doming, right? Foot activation, call what you want. Toes are into the floor. Your arch should lift, and you should be able to see that, right? So toes down, okay, my arch is lifting. As I do that, I actually teach people every time the toes go down, I need you to lift your pelvic floor. And when I teach the pelvic floor, I teach it in a way that people can differentiate the anterior and the posterior. Because interestingly, it's actually your posterior pelvic floor that connects to your feet.
Power Project family, this clip is brought to you by cocaine. I mean the cold plunge, because they pretty much do the same thing. Enjoy the clip.
Okay.
Feeling
Do you
things.
want?
Yeah, I'm just.
You're feeling things.
I'm
Okay,
just
okay,
like,
okay.
I'm trying to.
Okay. So the posterior pelvic floor is your levator ani. Okay. So you need to, every time you push your toes down, you want to imagine stopping your poo.
Yeah, I want to squeeze that booty hole.
Right? But you want to make sure it's not your glutes.
Yeah, not
Right?
your glutes.
Yeah. Not your glutes. Not your glutes. Yeah.
So don't flex your glutes when you do this, guys. You're not doing the Hank Hill pinching a penny.
No. Yeah. So don't squeeze the
Hank Hill
butt.
from King of the Hill.
Oh, sorry. Okay.
Yeah, sorry. Squeezing the
That's
butt,
it.
not squeezing the butt.
Not squeeze the butt. Lift the pelvic floor.
Yeah.
Right? Stop your poo, whatever. Sometimes you have to shut your eyes to be able to feel this a little bit more. And then you want to exhale. Okay? So you would, when I take people through it, they would inhale diaphragmatically. So they feel the belly rise. And then as the belly is starting to fall, because you're exhaling. So I want you exhaling the entire time.
Exhale, but not out of your butt.
You don't. This is serious.
I know you're good at this. I know you're very good at this.
I'm sitting over here practicing.
Oh my gosh. Okay. That's what that smell was.
I had to
All
clean
right.
up your Phoenix just because I knew you used it the wrong way.
Oh, God. Is there a different way to use it?
But okay.
We need to regroup.
No, we're good. We're good.
And we're back.
And we're back. Okay. Let's inhale again. Inhale. There you go. Right. So inhale. Okay. And then as you exhale, you want to start to push your toes down. And I want people exhaling the entire time. So for like 10 seconds, you're exhaling. And then as you continue to exhale, start to lift your posterior pelvic floor. Right. So you should feel this connection of my toes are down, my pelvic floor is lifting. I feel this kind of increase in distance between my feet and my pelvic floor, and my breath is leading that entire way, right? And then you would inhale again and then exhale, keep exhaling, start to lift the pelvic floor, toes down, really focus on the posterior pelvic floor, and then release. And you essentially would wave through this about 5 to 8 times. Now, the other way that you can also do it is, I call it toe to tongue. So you can get your tongue part of it, and the tongue is a really important part of your fascial system, that if you bring your tongue to your palate at the same time as pushing your toes down, you actually further activate this foot core. It's your deep front fascial line is what we're activating. So I would want toes down, pelvic floor up, but don't forget that it's your levator ani, and then bring your tongue to your palate. And then you should feel like you're stacked, right? And then I bring this into the hand. So this is where the sticks theoretically could come in, is that if you're holding something, I would have you guys can just hold the one. If you have 2 sticks, you could hold 2 of the sticks. That I would want you to push your toes down, lift your levator ani, tongue to palate, and then you're just going to squeeze the stick in your hands, right? And you are potentiating, and then you would kind of relax through it and then wave through it again. And I do this as movement prep. It seems, kind of crazy or just like, wait, what? Like this subtle little thing is going to really make a difference. But we have people that do this literally in the middle of a triathlon. And they're coming off the bike and they're going to do a few of this little potentiation, and then they put on their running shoes and they start running. And they're like, I remember the first time that some of the triathlon coaches would tell me, and they would say, okay, my athlete would be, doing this thing, and everyone's like, boom, passing and passing. They're like, coach, what the F am I doing? Like, they're like, trust me, we're just doing a couple minutes, right? And then they put it on and then go pass all those people and then would break their personal record. And it just has to do with the nervous system. I call it turning on light switches. I don't know if it's like the New Yorker in me that I was like, get efficient and like check as many boxes as you can. And like, I don't know, like I'm all about movement prep. To me, that first 15 minutes is like the most important part of a training session.
Peeps, we love bringing you all this fitness information, and we also want to help bring that information to more people. So if you could help us out, hit that Rev subscribe button and then hit the notification bell, and we'll continue to bring you the heat. And I won't whisper in your ear. Talk to you guys later.